Hi, good morning. My name is Becky Bean. First of all, welcome. Welcome to the 21st Annual Educational Summit. I know this year is virtual and many of you may be accustomed to some of the in-person opportunities and sadly can't see your faces and can't address questions, but certainly would leave the door open should you have questions after the fact. You can certainly float those to me via the foundation. And so wanted to really focus today on lupus and medication and approach to treatment and how we approach either non-drug interventions or drug interventions to help our patients thrive with lupus. So we'll start with an introduction and an overview of lupus. We'll talk about how we approach treatment, so the general approach. We'll talk more specifically around some of those non-drug interventions that we can try, and then we'll talk about when we progress to needing drug therapy, how those decisions are made, as well as how to monitor, how to manage medications, and then we'll close out with some more specifics around monitoring and thriving with lupus over the long term. So I'll start with just some general information on what lupus is. So lupus is a chronic inflammatory disease. What that means is our immune system will attack healthy cells rather than only attacking the infectious type cells. So instead of just attacking viruses and bacteria and protecting us from infection, the immune system is overreactive and can cause just damage by attacking those healthy cells. It is autoimmune. Most commonly, lupus affects some different areas of the body. So oftentimes it can have skin manifestations. It can affect the joints and cause joint pain. Sometimes it can be fatigue and fever and things like that. And then in more serious cases, you can see some involvement with some of the internal organs like our kidneys as well as our heart. So moving into types, there is a pretty wide spectrum of how folks may experience lupus. And so that means there's different types, different classifications. Oftentimes when we talk about lupus, we're referring to the more common type, which is systemic lupus erythematosus, which is SLE. There are some other less common types of lupus to know about. One is cutaneous lupus. There are some medications that can cause a lupus type reaction, and we'll talk about that. And then there's also another type of lupus that can be neonatal lupus, which can happen very, very, very early on prior to birth. In terms of who's at risk, what we see are some trends. Certainly it's impacting females more often than males. So we oftentimes see women between the ages of 15 and 44 being diagnosed with lupus. We do see some trends in terms of ethnicity and race and how that's translating into incidence of lupus, more commonly seen in African American communities, Asian American communities, our Hispanic and Latino communities, as well as Native American and Pacific Islander. We also think that there's a genetic component to this as well. So what we see is that there could be some increases in incidence of lupus in folks that maybe have some family history of some kind of autoimmune disease. So for example, you could have family members that have rheumatoid arthritis and see some trends to where if there's some incidence of that in the family history, we may be more suspicious of lupus depending on how somebody presents and what symptoms they're presenting with. So moving into our overview of treatment. So in terms of how we treat patients, it very much is individualized. So I mentioned this wide spectrum of how people will present, what types of parts of the body are impacted by lupus. So the treatment will very much depend on what areas are impacted. And it can be a tricky diagnosis to make because there's not really a great lab finding. There's no one test that we can do that tells us that somebody has lupus. And so it's very much a physical assessment that the physician will do and assess what are the signs, what are the symptoms, what's the entire medical history and presentation, and that's going to help inform diagnosis. And so much like the variability in how people present, there's a lot of variability in how people are treated. Our treatment is very much individualized to make sure that we're addressing what are those symptoms that one individual patient may be experiencing, and what kind of drug treatment has shown in the evidence to slow down either progression or exacerbations of lupus or clinical manifestations. So in terms of goals, there are a couple goals worth highlighting. And obviously, long-term survival is the ultimate goal. So we want people to thrive with lupus and have a very high quality of life. We want to achieve the lowest disease severity possible. We don't want to harm folks with the medications that we're using. So minimizing drug toxicity, preventing people from progressing into having organ damage. And then just helping empower people to be able to have a role and really own managing the disease in the home setting. And so it's really around the educational piece and making sure people have all of the information that they need to thrive while dealing with a long-term chronic disease like lupus. So moving into non-drug treatment. So there are certainly some options that don't involve starting a medication. There are non-drug measures and medical interventions that are really a part of this comprehensive approach to how we help patients thrive with lupus. I do want to start with lifestyle. So many of these are not going to be surprising. They're very much a part of a healthy lifestyle. But lupus in particular can be more sensitive to sun. So you can be more likely to relapse and have some skin manifestations if you're out in the sun for long periods of time without the proper protection. So making sure that sun protection is a part of the daily routine is really important. Really important to maintain a healthy diet. Make sure you're getting a balanced diet with all the appropriate nutrients and minerals and vitamins. Things like exercise become more important when you think about joint manifestations. Some of the things that you can do to stay healthy are maintaining a healthy weight, exercise, making sure you're maintaining that muscle mass, and all of those cardiovascular benefits that you get from exercise will translate into benefits in protecting from lupus exacerbations. And then smoking cessation. I don't think there's any chronic condition that is not made worse by smoking. And so finding a pathway to not engaging in tobacco use, but making sure that our folks are not exposed to that toxic smoke will help to maintain a healthy lifestyle. All right, moving into immunization. So vaccines are important. Vaccines are important for folks that have any autoimmune disease, but certainly lupus. And so there's some vaccines that are less risky in terms of causing some kind of a side effect or some kind of a reaction. So things like flu vaccine, pneumonia, hepatitis B, HPV, all of these have been proven to be safe in folks that are on some kind of an immunosuppressive treatment regimen. And so really important for folks, especially with autoimmune disease, to protect themselves against some of these communicable diseases. It is important to note that sometimes in folks that are taking a medication that's going to suppress your immune system, that you may not have the same antibody response as a result of that vaccine. So it could mean the vaccine's not as effective as it would be in somebody who's not on a medication that suppresses the immune system. One question that may be top of mind for many of you in the environment that we're sitting in and with the COVID vaccines out there, yes, COVID vaccines still would be recommended in this group of individuals. It's important to note that your immune response may not be as strong as it would be for a healthy person, but still very important to immunize and protect yourself against COVID-19. There are a handful of vaccines that are live vaccines, meaning that there's some viral component to the vaccine that helps to generate the immune response. And so those can sometimes lead to some complications in people that have a suppressed immune system. And so that's things like herpes zoster, so the shingles vaccine, measles, mumps, and rubella, polio. So those would be vaccines that I think are still important, but would be worth a conversation with your physician around what your individual risk is and whether or not you should receive that vaccine. Moving on to comorbid conditions. So obviously a part of treatment is treating what other things are presenting along with lupus. And so it's not unusual for there to be not just one condition that exists at one time. And so it's not uncommon for people with lupus to have other impacts. And I mentioned cardiovascular and heart disease can be a part of lupus. And so we certainly see some concomitant coronary heart disease, pulmonary hypertension, very important to treat those conditions should they overlay or exist at the same time as lupus. Things like antiphospholipid syndrome, for those of you who are not familiar with that, it's essentially a clotting disorder, and it can mean that people with lupus that also have antiphospholipid syndrome could be more at risk for developing blood clots. And so there are some treatments that we can provide to help people protect and prevent blood clots that would be really important in this population of patients. And then lastly, I'll mention bone health. So osteoporosis can be a potential complication, and some of that is tied back to what medications we may use for lupus. Things like prednisone and steroids can tend to increase risk of osteoporosis. So it means that we would want to prevent or protect against fractures and any bone loss in the future. So things like calcium and vitamin D, and depending on the situation, sometimes there are some preventative medications that we would use specifically for osteoporosis in this population of patients. All right, so moving into just some general medication issues, things to know about medications. So there can be a predisposition to having allergies to antibiotics. And so what we see sometimes in folks with lupus is more of a tendency to have allergies to antibiotics. In particular, sulfa drugs, sulfa-containing antibiotics can be associated with a lupus-like reaction. So that's important to know in somebody that already has pre-existing lupus. There are some medications that can cause and contribute to a lupus reaction. So things like procainamide, which is a medication often used for heart rhythm disorders, and hydralazine, which is a medication often used for blood pressure, heart failure, things like that. And then also there's an antibiotic called minocycline that should be avoided in folks that have established lupus. So a couple of just general medication concerns that I wanted to share with the group for awareness. All right, so moving into our approach to drug therapy. So this is, again, very much tailored to how somebody's presenting, what symptoms they have, what parts of the body may be impacted, but also very much customized based on how severe of a case somebody's presenting with. So we don't want to, we want to minimize drug toxicity, right? So we want to make sure if we're going to add a drug that the benefit is more likely to be higher than the risk of some kind of an adverse event related to the medication. So in terms of general approach, again, individualized. What are the symptoms we're treating? Which organs are involved? What's been the history? So in some cases, in folks that have thrived with lupus for a very long time, there may be examples of medications that just didn't work, or there were adverse events as a result of those medications. And so we don't want to repeat. So we're going to approach treatment based on what's worked and not worked in the past. And then we're also going to approach treatment based on the severity of the case of lupus. And so making sure that we're minimizing any risk for drug toxicity, but aggressively treating if folks have actual organ involvement. So I'm going to start with mild disease. So in the case of mild lupus symptoms, there's some sort of initial primary treatment that you would see really across most of the types or severity levels of lupus. The mainstay of treatment tends to be hydroxychloroquine or chloroquine, unless there is some clear contraindication. So there is evidence that supports the hydroxychloroquine or this type of treatment can reduce risk of flare. This type of treatment can reduce clotting events, progression to organ damage, as well as death. So there's some good evidence to support that these drugs can be effective in preventing some of the more serious and significant complications of lupus. Hydroxychloroquine, many of you probably heard a lot about it in the news because it was a medication that was early on tried for treatment of COVID-19, but certainly an effective treatment. It does have some risk for side effects, things like arrhythmia, so that it's not just everything comes with a little bit of risk, but it is a medication that is pretty common in folks with lupus because of the risk to benefit ratio seems to favor in the benefit side. Depending on symptoms, you may want to add something like a non-steroidal anti-inflammatory drug. So NSAIDs for short. This would be our medications like ibuprofen, like Aleve, naproxen. So those anti-inflammatories that we tend to think of for arthritis can be effective in treating the pain that can be associated with lupus. I would put a plug out there there are risks with the non-steroidal anti-inflammatories. Most significantly, you can see some stomach challenges. So some people can go on to develop bleeding ulcers if they take this for a long period of time without protecting their belly with things like food and even some acid controllers that can help protect the body from ulcers. So it does come with some potential side effects. We also would want to use caution in long-term use. So there's some studies that say long-term use of non-steroidals can be damaging to your kidneys and things like that. So it is an option, but typically you would see it used more on a short-term basis or on an as-needed basis to avoid some of those complications that can come with long-term use. Moving into moderate disease. So if this would be an example, would be a patient that has significant symptoms impacting quality of life, but has not yet progressed to having an organ-threatening case of lupus. And so we would still use our initial primary treatment, mainstay of treatment, which would be your hydroxychloroquine, but we may add in a short course of prednisone, which is a steroid. So prednisone is a steroid that suppresses the immune response. Oftentimes what you will see is a taper. So you might start with a high dose of prednisone and then taper off over a period of time. There are some side effects that we would want to be aware of with prednisone. So much like the non-steroidals, there can be some stomach side effects. We can have some challenges with weight gain. We can have some challenges with long-term use causing a little bit more risk for blood sugar abnormalities. So some folks on long-term prednisone can end up progressing to where they have more challenges with diabetes. And we also see some risk for osteoporosis and thinning of the skin. So great medication for a short-term treatment, can be a little bit, can have some side effects if used on a long-term basis. And then there's some other options that we call steroid-sparing options. So there's some medications that suppress the immune system, but don't contain a steroid. An example of that would be azathioprine, methotrexate. Again, these are medications that do need to be monitored. Typically, we'll monitor liver function tests, we'll monitor blood counts and things like that. So they're not things that we would not monitor, but they are options. So it's all about tailoring the treatment to the individual, monitoring how somebody does, and making sure that we're minimizing any risk of toxicity related to the drugs that we're using to treat lupus. All right, moving into severe disease. So this is where we may see more organ involvement. And so typically what would happen is we would intensify the treatment. So we're going to start with the initial drug therapy, the mainstays, and then if we need to, we're going to get more aggressive in treating lupus. And so this is where you may see some high dose glucocorticoids to rapidly reduce inflammation. So progressing from more of a prednisone taper to a high dose steroid regimen. We also may add additional immunosuppressant agents. So some examples of that, we already talked about azathioprine, but there's some other options like mycophenolate, cyclophosphamide, rituximab is another medication that's been used with some success in this setting. So with severe disease, you're going to start with your initial therapy. You probably will intensify the maintenance therapy, get somebody down to more of a controlled situation, and then start to tailor back on the medications. And so it's really, again, adding when you need to add, getting aggressive when you need to get aggressive, but then tailoring that that drug therapy back when the exacerbation tends to get a little bit better. All right, I did want to spend just a few minutes talking about lupus nephritis. So this is a specific type of lupus that impacts the kidney. Treatment is very much dependent on how it's classified based on a kidney biopsy. And so you've got 3 different options that we see. So active focal, diffuse, and then lupus membranous nephropathy. And so initial therapy, not all that different from the other types of lupus. So initial therapy would include a glucocorticoid plus mycophenolate or cyclophosphamide, followed by some maintenance treatment. But did want to mention this, there is a new drug that has recently come out, and so I think we're still learning what the role for that new medication is in treating lupus nephritis, but it certainly gives us another tool in the tool belt to help patients that may have failed some of the previous medication therapies that we use in the setting of lupus nephritis. All right, oops, I think I skipped monitoring. Sorry, guys, flipping around a little bit here. All right, I did want to close out with just some guidance around how we would monitor people over the long term. And so the frequency of this monitoring is individualized. It very much depends on the patient. Oftentimes we see our lupus thrivers, have a longstanding relationship with a rheumatologist who is skilled and expert in managing lupus. and they'll dictate how often folks need to be monitored. But oftentimes, depending on what drug regimen a patient is on, there's going to be lab testing that we may do most often to make sure that we're keeping patients safe on the medications that they're taking, and that we're always evaluating, do we have the right regimen for that particular patient. We'll also track some of the disease activity indices, so helping us constantly reevaluate severity level, what's a flare, what's not a flare. We'll take into consideration adverse events, what might be impacting things like weight gain, risk for infection, worsening diabetes, osteoporosis. Some of those complications that I shared could be a part of drug therapy, but also could be a part of comorbid lupus plus having other disease states that we have to manage. And so again, the monitoring will be a comprehensive view of where somebody is, how they're doing with their disease. Are they maintaining on the therapy that they're on? And that will include a total assessment. And it's not uncommon to see regimens tailored over time, depending on how folks thrive. And so we see that oftentimes in this monitoring, but did want to make sure that I highlight the importance of monitoring. So it's important that you stay connected in with your physician, because the more preventative and proactive we are, the more successful people will be in thriving with lupus. So with that, I am going to close out my portion of the educational summit. Again, I wish I could see you in person and we could engage in some dialogue and I could address some individual questions, but certainly should you have individual questions, I will attempt to answer them. You can float those up through the foundation, I suppose. And just excited to have the opportunity to share a little bit of my knowledge and experience around medications and how that relates to helping patients thrive with lupus. So enjoy the rest of the summit, and my hope is that we'll have an opportunity to engage in the future.